Hi everybody, this is Matt. We're continuing our series on Know Your Heart, the conduction system, and today we're talking about the Atrio-Ventricular Node, or the AV node. And again, we will return to anatomy, and again we will refer to the compendium, Arrhythmia Compendium, number 2, from Professor Sesto from Mannheim, the University of Mannheim in Germany. And that is his book, and this is the depiction that we've seen a couple of times already. And this is the area of the AV node, or the AV-Knoten. And again, you can see that electrical signal is associated, if you follow up the vertical line, up to that point of the Oberflächen EKG, or the surface EKG. So that's where the AV node is positioned within the heart. The AV node has a very important role as a gatekeeper of the ventricles. The atria, specifically the SA node, or the pacemaker of the heart, has the duty to initiate the electrical activity of the heart in a normal heart. And it does that normally quite well. Sometimes it does not work that well. Sometimes it's overwhelmed by heart rhythm disturbances like atrial fibrillation, which initiates up to 300-400 signals in the atria for the AV node to manage, which you can imagine is an incredibly important task to keep the ventricles from responding to those abnormally high inputs that the atria can create in atrial fibrillation. So that is on the extreme fast end of things. Now, if the pacemaker is not doing its job well, and if it stops doing its job, the atrio-ventricular node has to step up to the plate. And if it does, what will be indicated on the heart rhythm is the absence of a P wave. A P wave is the wave that indicates the signal coming from the SA node, or the pacemaker of the heart. If that doesn't happen, somebody's got to do the job. And the job in that situation is the job of the atrio-ventricular node, or the AV node. That would also, in many cases, be indicated because the AV node's intrinsic rate, or its natural rate to fire, is slower than that of the SA node. The SA node's intrinsic or natural range of firing is, as I said before, 60 to 90 beats a minute. For the atrio-ventricular node, or the AV node, it is about 40 to 60, or 30 to 60, somewhere in that range. So if the pacemaker of the heart's not doing its job, then you may see on an EKG or on a heart rhythm monitor the absence of P waves, and this is called a junctional rhythm, and its origin is coming from the AV node. It's firing to bring some signal down to the ventricles so the heart continues to beat. And if that doesn't happen, there's big trouble. So that's essentially all I wanted to present about the AV node. It is further down in the conduction system. It has this gatekeeper role for either the absence of signals coming from the natural pacemaker of the heart, or the overwhelming number of signals coming from the atria in heart rhythm disturbances like atrial fibrillation and also atrial flutter. So it has an important role, and it is the kind of the last stop before electricity travels on down to the ventricles to pump blood both to the lungs to pick up oxygen and from the left ventricle out to the body to deliver the oxygen. And that's it. So that's the AV node. That is part 2 in terms of the specific components of the conduction system of the heart. And next we're going to get into the transition or the conduction of the electricity down into the ventricles in the next several sections. And that's it. Have a great day.